There's no teaching, training, certification, wet lab, anywhere for people to learn this. So how do you go about this? Well, that's my goal, is to share what I've learned over 18 years and make you a little bit more comfortable with even just treating the more simpler, I hate to say simple, more straightforward cases. A simple, small Weiss ring in a good anterior posterior position, not too far out into the periphery, in big pupil, clear lens, clear cornea. That might be the ideal starter, and you might not pursue this much until you happen to have that one particular patient sitting in your chair, and you look in there and they're not just noticing the floater, but they're bothered by the floater, and they ask you about it, and you're like, well, we can break this down a little bit to where it doesn't have to be perfect, but just a lot better. You don't have that big thing distracting you. That might be a good way to start out there, and you might just stick with that. You might just kind of cherry pick these simpler and more straightforward cases, and if you come across something more complex, which is more of my typical patient, and I get patients from all over the country and all over the world. I get, in fact, just this week, Croatia and Finland, which is a real testimonial to how much these things bother people. But if you want to send the more complicated ones to me, I'd be glad. That's how I made my reputation, is treating the hard stuff.